Welcome to Evergreen Family Medicine. Today we are with Beth Bunt. She is the operations manager for Evergreen Urgent Care. Thank you for being here.
Hi, thanks for having me.
Well, we're about a year into COVID now, and as it turns out, though, Evergreen's response to the pandemic started well before March 16th. When you think back to the beginning days of the pandemic, what do you remember?
So I remember in the very beginning hearing about an outbreak on the news, and we actually have quite a few tourists in the spring and summertime in Roseburg, and decided that in that first week in January we would start screening patients to see if anyone had traveled from China before they even got into the building. So that would be the first thing we would ask, and started that right off the bat, and have slowly added more screening in as we've gone along. We met together as an administrative group and really were given a kind of open rein from administration and the board to really be proactive in this. And we were, sat together, we found out what our first initial goals would be. Number one would be to be able to treat the ill while still protecting our well patients, having a large family medicine patient base, and then our urgent care treating as many patients as they do a year. We needed to make sure that we kept both going and still kept people separated, the ill from the well. So we worked really hard at that. We had the first countywide meeting, I believe, on the 9th of March. But by the 10th, we had policies on what we would do if schools closed, what we would do if we were mandated to send people to work from home. We figured out what was our skeleton crew. We called that a code white. What would we end up with if we had to send everybody home but still be able to do our jobs and treat patients? We figured out our shortcomings. We wanted to make sure that we knew where our weaknesses would be, and we wanted to see how many patients, potentially really ill patients, we actually could handle. And we spent a lot of time working on those, getting them approved, and they're still in place today. We've made a few tweaks, but it's helped us to really not have to be reactionary at all through this.
One of the things I remember early on is that Evergreen was treating patients in their car. Can you talk about that drive-through practice?
Yeah, so one of the things that we knew we needed to do is to maximize our technology. So we've been using Phreesia for quite a while now. They had a really nice ability to push the Phreesia interview to patients' mobile phones, so we didn't have to actually lay hands on their information. We didn't have to give them the pad. We're already introducing telemedicine in our family practice, so all of that stuff was already in the works, and so it was really easy to just maximize that. We still are doing curbside visits today, and if they can have their entire visit, even our providers will still go out and see them in the car, and they don't have to set one foot in the building.
Let's shift into what it was like inside Evergreen. Talk about the way the teamwork unfolded as COVID became more of a reality.
We, for the first time, all of us managers had really gotten together and said, I have employees with these skills, you have employees with these skills. It was the first time we really shared employees across departments. In planning for a potential volume of cases, we had to make sure we had enough bodies. And so doing the cross-training, working together. Right now we're in the process of giving as many COVID vaccines as we potentially can. And every single patient is so grateful to have their opportunity. They are so nice and patient with us, as we try and get through the crowds and, keep physical distancing and all of that stuff into play as you're trying to vaccinate hundreds of people. We actually vaccinated 467 patients the other Saturday, and it was an amazing feeling. And those patients are so grateful, and it makes it so much easier for us to put in the extra work. Those of us, that have been there since day one, we're still standing, we're still coming in with smiles every day and trying to figure out how can we do it better. And that's the kind of people you want to surround yourself with every day.
Well, usually what happens in crisis is that you find out what you're made of. And I've heard it said in sports that adversity doesn't create character, it reveals it.
We're going to create our own new normal because I don't think we can ever go back. But what we can do is go forward better.
Well, thank you very much, Beth. Appreciate your time. Beth Bunt, the operations manager at Evergreen Urgent Care. You can find out more about how Evergreen has responded to COVID then and now at evergreenfamilymedicine.com. And you can follow Evergreen on Facebook, YouTube, Instagram, and Twitter.